11 early signs of cancer you should not ignore. Cancer is a word we don't want to hear when it comes to our health situation or any of our loved ones. But little do we know, in the US, cancer is the second most common cause of death after heart disease. Most cancers are symptomless during the early stages, but a significant percentage of cancers show some particular signs at early stages, and we should never ignore those signs. The disease can be particularly devastating if you ignore symptoms. At later stages, cancer becomes incurable and life-threatening. Let's start our video with particular signs of cancer we should never ignore. Number 1. Lumps. Obviously, we all notice lumps that are painful and bother us, but the painless lumps are the ones we ignore. Cancerous lumps often tend to be painless, so you can't just wait around for any odd lumps and bumps to start feeling sensitive or painful, as that may not happen. They may increase in size as cancer progresses, or they may not. Either way, get any swellings checked as soon as possible. According to a research, about 90% of men with cancer of the testicle had a painless or uncomfortable lump on a testicle. Some men had an enlarged testicle. Other conditions, such as infections and swollen veins, can also cause changes in your testicles, but any lump should be evaluated. Men are advised to conduct monthly testicular self-examinations. Number 2. Breast changes. Most women are hesitant to get their breast lumps examined. It is true that breast lumps aren't cancer, but your doctor should always check them. Let your doctor know about the changes other than lumps, because these might suggest cancer. Changes like skin dimpling or puckering, an inward turning of nipples, nipple discharge or redness, or scaling of your nipple or breast skin. To look for the cause of your symptoms, your doctor will do a physical exam and ask you questions about your medical history. You may also have tests like a mammogram or a biopsy, where doctors remove a tiny piece of tissue for testing. All of this for the early diagnosis of breast cancer. Number 3. Persistent cough. Have you been coughing for 6 months? And now you have stopped noticing it because it has become a part of your life? Well, that's not a good sign. Seasonal flu and cough are obviously no signs of cancer, but chronic coughing, however, is a different game altogether. Having a cough for months at a time isn't normal, particularly if it causes you to become breathless or makes your throat so sore that you have difficulty swallowing. People with lung cancer tend to have a cough that won't go away. That cough may change to become more painful, sound different, or bring up colored mucus. Esophageal cancer is also defined by a cough that won't go away, as well as difficulty swallowing. Number 4. Bloating. According to Marlene Mayers, an oncologist at NYU Langone Medical Center, women are natural bloaters. It's okay to wait a week or two to see if it goes away. But if your symptoms don't get better with time, or if they happen with weight loss or bleeding, see a doctor. Bloating is a common problem among women, but constant bloating could be a sign of cancer, including breast, colon, gastrointestinal, ovarian, pancreatic, or uterine cancer. It is better not to ignore this sign and go see your doctor. There can be early detection of cancer through several tests like mammogram, a colonoscopy, a CT scan, or an ultrasound. Number 5. Weight loss. If you haven't been actively trying to lose weight and find that you have suddenly lost a few kilograms, then don't be happy, because that's not a good sign. Losing weight when you're not even trying to is a very common symptom in people with cancer. It may be one of the reasons you first go to the doctor. An unexplained weight loss of 10 lbs or more may be the first sign of cancer. This happens most often with cancers of the pancreas, stomach, esophagus, or lung. Weight loss rates depend on the cancer type. with around 60% of people living with lung cancer having lost a significant amount of weight by the time they were actually diagnosed with the illness. Number 6. Fatigue. Who isn't tired these days? But there's a difference between being a bit sleep deprived and having a complete lack of energy. Fatigue for people with cancer might not go away even when you rest, says Cancer Research UK. It can go on for weeks, months, or even years after you finish treatment. This is called chronic fatigue, which means long-lasting. If you have that chronic fatigue, it's time to see a doctor, and don't ignore the symptom. Number 7. New or changing moles. We know that moles have some relation to skin cancer, but many of us have no idea what we're really looking for. You might not necessarily get a massive growth appearing which looks obviously cancerous. You need to be on the lookout for any new moles or any changes in the size, shape, or color of existing ones. If they become crusty, bloody, or seem to ooze out any liquid, they also need to be checked out. Number 8. Change in urination. Urinary symptoms can be due to some kidney disease, but these symptoms, like frequent urination, small amounts of urine, or a general change in bladder function, can be caused by urinary infections or by an enlarged prostate gland. Men experiencing urinary symptoms should not ignore these signs because it can lead to prostate cancer. And these symptoms need further investigation, possibly including blood tests and a digital rectal exam for the early diagnosis of prostate cancer. Number 9. Heavy night sweats. Do you ever wake up in the morning absolutely drenched in sweat? Or your palms are always sweaty even during winters? Well, that could be down to a number of things, like menopause, medications, or hormonal disorders. But night sweats are also an early symptom of some cancers like lymphoma. Most people will experience other symptoms too. 70% of those living with Hodgkin lymphoma, for example, will have a swollen lymph node in their neck, and a quarter will then have a symptom like night sweats. Number 10. Excessive bruising. Bruising in childhood is common because kids fall all the time. Finding a bruise following a fall isn't a reason to worry. But if you are an adult and you didn't even have an accident and you still notice bruises popping up consistently or in strange places like hands, fingers, and toes, you may need to check with your doctor. According to Cancer Treatment Centers of America, leukemia cells block red blood cells, hindering their ability to carry oxygen, which leads to blood clotting and thus bruising. Number 11. Pain. Pain is a part of most acute illnesses and it's nothing to worry about. But if you're having pain in a certain area for months that doesn't go away with medication, then it is a thing to worry about. Pain may be an early symptom of bone cancers or testicular cancer. Most often, pain due to cancer means it has already spread from where it started. Unusually heavy, painful periods are a common sign of uterine cancer, and back pain can be an early sign of liver cancer. Many people don't know that breast cancer can exhibit itself through back pain as well. The tumor may press backward and spread to your spine or ribs. So it is important not to ignore pain in such situations. Well, these are the signs you should never ignore and immediately see the doctor. Hope none of us has to experience such symptoms. And to avoid that, there are other habits you can adopt to protect yourself from cancer. Exercise regularly, get consistent cancer screenings, and learn your family history to reduce your risk. And do give us a thumbs up if this video was helpful. Bye bye, till next time!